Welcome to Pharmacology lectures. Today we are going to study some case studies. We are going to solve them. Okay, we have started the topic of ANS. This is an overview. Sympathetic nervous system and parasympathetic nervous system. It is also called fight, flight or freeze, and that is rest and digest. The things which increases in sympathetic nervous systems are heart rate, respiratory rate, BP, and pupil dilation. Okay, not constriction. It increases. And parasympathetic system, as it is rest and digest, so digestion increases. And what decreases in sympathetic system is digestion, the opposite, and urine production. And here all the things which increases in sympathetic system, they all decrease in parasympathetic system. Now first one, botulinum toxin blocks the release of acetylcholine. We have studied in our previous chapter from cholinergic nerve terminus, which is a possible effect of botulinum toxin. What is the effect if it blocks the release of acetylcholine? Now see, acetylcholine is released by cholinergic neurons. Okay, cholinergic neurons, acetylcholine is released. Now cholinergic neurons act on nicotinic receptors in the skeletal muscles and it causes contraction. Now if you block the release of acetylcholine, if this is blocked, which means skeletal muscles cannot contract, skeletal muscle paralysis will come into effect. Now myasthenia gravis is an autoimmune disorder where antibodies are produced against the nicotinic receptor and they inactivate the receptor, whereas a reduction in the release will worsen the symptoms of this condition. Reduction in acetylcholine released by botulinum toxin will cause reduction in the secretions. Now this will also cause reduction in salivation. It will not increase the salivation. Dry mouth and increase in heart rate, not decrease in heart rate. Now next case study is a patient develops urinary retention after an abdominal surgery. Now urinary obstruction was ruled out. Which strategy would be helpful in promoting urination? Which strategy should we use? Now, activating nicotinic receptor, inhibiting the release of acetylcholine, inhibiting cholinesterase enzyme, blocking muscarinic receptors. Activation of muscarinic receptors in the detrusal muscle of the urinary bladder, will promote urination, where the tone of muscle is low in those patients. This will happen when you activate the muscarinic receptors. If inhibiting the enzyme cholinesterase enzyme, what will happen? It leads to the breakdown of acetylcholine. If you inhibit the breakdown, acetylcholine will increase. Acetylcholine can increase the tone of detrusal muscle in the urinary bladder. There are no nicotinic receptor in the detrusal muscle, therefore activation of nicotinic is not helpful. Inhibiting the release of this is not helpful. Inhibiting the release of acetylcholine will worsen the condition. Blocking muscarinic receptors will also worsen the condition. So the option C is correct. Which of the following drugs could theoretically improve asthma symptoms? Bethanicol, pilocarpine, pyridostigmine, atropine. Because it does not constrict. Muscarinic agonist, always remember, muscarinic agonist, which increases the level of acetylcholine, will cause bronchoconstriction. This you have to remember the process. So therefore bethanyl pilocarpine are muscarinic antagonists, therefore they will constrict the bronchus. And pyridostigmine, it is cholinesterase inhibitor. So indirectly, when it blocks the enzyme cholinesterase, which will break down the acetylcholine, if this is blocked, acetylcholine will increase and bronchoconstriction will happen. Therefore this is not allowed. Atropine is the drug theoretically, but actually it is not used. If an ophthalmologist wants to dilate the pupil, okay, this is an important question for an eye examination, they are often using it. Which drug class is theoretically useful? Now you can see muscarinic agonist, antagonist, pilocarpine and neostigmine. Now muscarinic agonist, example pilocarpine, contract the circular smooth muscle in the iris sphincter and contract the pupil. It causes miosis, whereas we need dilation. Anticholinesterase inhibitors, neostigmine or pyridostigmine, will also cause miosis. Muscarinic antagonist will relax and they will cause mydriasis. So the option B is correct. Now in Alzheimer's disease, there is a deficiency of cholinergic neuronal function, okay, deficiency. Which strategy is useful in treating the symptom, okay? Inhibiting the cholinergic receptors, inhibiting the release of acetylcholine, inhibiting the enzyme, or activating the enzyme. Now because there is already a deficiency